Well, I've officially messed around with trying to figure out how to put myself on screen with all of my slides, so hopefully this works out. I'm Amanda West. I'm a student here at Eastern Oregon University, and I'm presenting on dissociative identity disorder. This has proven actually to be a super fascinating disorder. It was formerly known as multiple personality disorder. Some people think about movies that have depicted characters with multiple personality disorder, such as Sybil, or most recently Split with James McAvoy. This disorder is basically that's the disorder that those characters have had. The DSM-5 criteria of DID, basically there's a disruption of identity characterized by two or more distinct personality states or an experience of possession. Basically there's more than one personality. Some researchers refer to this as alters. There's recurrent gaps in memory for events or important personal information that are beyond ordinary forgetting. In fact, amnesia is one of the characteristics of this particular disorder that sets this disorder apart from other disorders such as schizophrenia or other personality disorders. The symptoms of this disorder are still controversial in the psychology world. They're not due to drugs or medical conditions. In fact, dissociative identity disorder, one of the biggest causal factors, according to research, is severe childhood trauma. The individual has at least two separate personalities that act independently of each other. A lot of research indicates that sometimes these personalities aren't even aware of the other personalities. The personalities emerge at different times, and each personality may be unaware of the other personality, as I previously stated. Some research has even indicated that there is the one primary personality, the host, if you will, and that's actually the person that seeks treatment. That's generally the responsible party, the biological party, and that person has suffered greatly at the hands of an abuser, generally in their childhood. They have suffered childhood abuse, whether physical, sexual, or both, that has been so severe that actually the person begins to compartmentalize their memories, and in so doing can develop another personality in order to cope with the severity of the trauma that they were going through. The personalities developed tend to be very different from the primary personality. In some cases, in some case studies, the personalities can actually have their own voice that is different from the primary person, different handwriting even, and even a different sex. There was one case study that I read in which the primary person was female but had a male alter. So very interesting there. DID is not generally diagnosed until adulthood. A lot of these patients tend to show symptoms in childhood, but again, they don't start seeking treatment until they're older. And generally when they're seeking treatment, it's actually for symptoms of depression or PTSD. So they're not even aware of their other personalities until they're actually in treatment. DID is more common in women. Other diagnoses generally present are PTSD, MDD, somatic symptom disorders, personality disorders, also sleep disorders. Again, this is a controversial diagnosis that a lot of research is being conducted to kind of disprove the fact that this should be controversial. A lot of these patients have severe headaches, hallucinations, again, amnesia, suicide attempts, self-injurious behavior, cutting, different things like that. Amnesia is a core symptom of this disorder, and multiple studies have been conducted to investigate the presence of amnesia across all the personalities in DID. In one of the case studies that I read, a child personality was only able to recall just a little bit of what the primary personality actually reported. In that particular case study, the child personality would come out to discuss a specific time period in which that person had suffered some trauma. So DID, again, is a disorder that a lot of researchers believe is actually formed because people are compartmentalizing their traumatic memories. Theories suggest patients diagnosed with DID suppress their traumatic memories and childhood abuse as a defense mechanism. And this phenomenon is associated with dissociative disorders. In the study that I just had mentioned, the subject was dissociated from her memories by adopting a child personality, I should say. This finding suggests that DID patients attempt to protect themselves from traumatic memories by dissociating. This particular subject was found to have multiple personalities with 23 different alters actually documented by her psychiatrist. She was aware that some behaviors occurred, such as she would actually wake up the next morning and find clothes that she didn't recognize in her room, but she was not aware of the behaviors in all of her personalities. Another case study that I researched was a case study of a woman named Jackie. Jackie's therapist, she actually went to her therapist and they established a relationship by having therapy sessions 1 time a week. And the therapist then upped that to 3 times a week once she realized how fragmented and dissociated Jackie actually was. And over a period of 6 years, Jackie actually was able to integrate all of her personalities. It was identified that she had 8 different alters, and she was able to integrate them through treatment so that she became just one self and no longer had those different personalities. She had a specific child alter named Lucy, and that alter came out the most during treatment. That alter specifically remembered memories of abuse by her father. She was actually impregnated as an adolescent by her father, and she actually came forward with information about sexual abuse from her own mom, molestation, and a lot of hurt and pain that her mom didn't protect her and her brother from sexual and physical abuse from her father. So again, had kind of suppressed those feelings that came out with the different personalities. The therapist for this particular subject actually experienced transference and countertransference during treatment. There were times that therapist actually felt unsafe and anxious and fearful during some of their sessions, where she actually wanted to cut those sessions short because she would hear of the different traumas this woman had gone through, and it was really challenging and very difficult to hear after 6 years of treatment, Jackie actually abruptly ended their therapy sessions because she felt that she had integrated, and then she was done and no longer felt like she needed therapy, just to the chagrin of her therapist, who didn't feel like their time together should have ended so quickly. The different etiologies of DID is highly controversial still, but it's widely accepted that one of the major causes of DID is severe physical or sexual abuse during childhood. There are two different types of models. There's a post-traumatic model. Children who experience abuse are at higher risk for developing dissociative disorders. Children who develop dissociative symptoms are then likely to develop psychological symptoms as well. The sociocognitive model actually states patients in treatment for symptoms following abuse may develop altered personalities due to their response to therapists, media, or other cultural influences. And also with this model, it's believed that suggestions by therapists may encourage or reinforce memories or alter personalities that don't actually exist. So essentially, this model believes that these patients did in fact suffer some childhood trauma. However, it's a possibility that their therapists are making suggestions and creating these personalities as a form of manipulation, basically to form something that isn't there. So again, therapists can manipulate treatments to cause DID symptoms. Hypnosis is actually one of the treatments for DID, and there's been some reports that there have been therapists that use hypnosis unethically to make suggestions to patients that they have these personalities that they don't actually have. A study in 2014 was published in the Australian and New Zealand Journal of Psychology investigating the validity of the diagnosis of DID. And through all of their studies, they basically gathered research, scholarly research from over the last 30 years addressing the diagnosis of DID. More data is currently accumulating even today. And the things that they did find was that the current diagnostic tools in order to diagnose DID are lacking, and a review of this is necessary. And that the studies confirm that there is a consistent link to childhood trauma. They believe that all the research has been valid. And over 50% of patients with DID did self-harm or abuse substances. Another study investigated the association of intimate partner violence and childhood maltreatment with DID. Using the clinical reports from therapists that actually treat DID patients, and then actual self-reports from DID patients, researchers found 80 to 95% of the patients with DID experienced childhood maltreatment. It's a very large number. In addition, DID patients exhibit high rates of interpersonal violence and sexual aggression towards others, generally their partner, with little empathy because of their own experiences that they've had with abuse. Different treatments for DID. One treatment is a phasic treatment model. This is very popular in the psychology world for treatment of DID. The different stages are to establish safety and stability, and you actually see this stage in other treatments as well. It's very important that safety and stability is established for the patients so that they can go further with treatment. If they don't feel safe or stable within their treatment setting, then investigating the trauma, emotions, and behaviors that they have experienced isn't a platform that they feel safe doing. Once you're able to establish safety and stability, then stage 2 is to maintain that stability and then start investigating the trauma that the patients have experienced. Stage 3 is to begin merging or integrating those identities the different alters and encouraging life without dissociation. This particular treatment has produced positive outcomes and reductions in symptoms. Another treatment is hypnotherapeutic interventions. Hypnosis, when it's used ethically, can be very successful. The thing to look out for when doing hypnosis on DID patients, most of these patients have experienced some form of abuse, and their abuser had encouraged them to be very quiet, to keep shut, to just relax. And so when preparing a patient for hypnosis, you just need to be careful with your relaxation methods, that they feel safe and they don't feel like they're in the hands of an abuser. Stabilizing, again, is very important in the trauma work. Once the patient is in a state of hypnosis, then you can access and contain alters. One case study that I read, the therapist actually was able to access the alters of his subject named Gwen, and actually encouraged some of those alters to try different beers even, in order to basically establish a rapport with those alters and gain trust, so that during his time of therapy, he had the trust of each alter and was able to start introducing those alters to the primary personality in order to start integrating. Another treatment is with psychopharmacology. Medications are generally prescribed to treat the other symptoms of DID. Major depressive disorder is a common comorbidity with DID. PTSD, anxiety disorders, sleep problems. So medications are generally prescribed to help with those symptoms. And it's individualized. Not every patient responds well to the medications that treat those disorders. So a lot of communication with the psychiatrist and the therapist and the patient during this time is very key, in order to tailor the medications to that patient. Not all medications work, and medications can be useful in conjunction with cognitive behavioral therapy or the different therapies that I've mentioned. Here are the different references and the different case studies. This was, again, very fascinating, and I wish I had more time to cover some of the case studies that I read. Very fascinating disorder for sure.